We all know that obesity is a major public health issue, and we've not seen the success we would have hoped for in the last decade. Through our research at Leeds Beckett University, we've recognised that systems-level thinking is critical to this, and big data is a key tool in how we start to understand the local environment, how we influence citizens' behavioural change.
Leeds is not immune from the global obesity epidemic. Almost 20% of 10-year-olds in the city are obese, and we know the huge impact that obesity can have on diseases, health inequalities and costs to the health system. If in Leeds we're going to have a sustainable health and social care system, then we must address the burden of obesity and unhealthy lifestyles.
Our tool is an open data platform focusing on Leeds residents to help them change their lifestyles for the future, but it has national capability too.
The type of research that we do at Leeds Beckett University is applied research. This means it's designed to influence policy and practice. Data is very important to us. If this project goes ahead, for the first time we're going to have data from various agencies in one place. The data is also going to be available in a very user-friendly manner. So for us, it will help us to understand what the facilitators and barriers are in terms of behaviour change. It will also allow us to understand individual and community and environmental factors that influence the development of obesity. And we can use this information to develop much more effective and tailored interventions.
Leeds has an ambition to be the best city for health and well-being, and Leeds Beckett University is at the forefront of working with its partners to change that through enabling the use of big data to make sure that decisions are evidence-based and not based on opinions. But it's also important that we empower and enable our local citizens, and through the tools that we will provide and behavioural thinking and behavioural economics, such as providing the skills to have the capability, the opportunity and the motivation, we believe Leeds residents will benefit from this by changing their lifestyles for the better.
Data visualizations are a really good way to help people make sense of data that is relevant to them. So it may help them understand their community better or understand their own behavior and see why they might be doing things or why their neighbors or other people they know behave in a certain way. Visualizations also help seeing the familiar with new eyes and to discover new things in information that may seem really mundane and not very accessible. What we're proposing for this platform is to take the various data sets. This is all raw data and it's by its very nature very inaccessible to general public and even to some specialists. So we're going to take this data and find connections between all the different data sets and then present this in a much more accessible and visually aesthetically pleasing way so that people can find data that is relevant to them and draw their own conclusions from this data. The platform will be an overlay onto Google Maps and it will allow people to pick out different areas of interest for their local community and see them visualized on the map. And that may be related to obesity prevalence in their area. It may be related to items on the map, such as food outlets, different ways to get from A to B. There may be a more healthy route to take if you want to get to your place of work, for example. And the map can make suggestions in that sense.
This tool is a good example of how our city's strengths in obesity research, data analytics and strategic priorities can be combined to create something that can help people make better decisions for their health.
Being a resident of the Leeds City region, working and living and having children at school in the area, I think having access to this kind of tool will be invaluable in making informed choices about the way I live my life and the lifestyle of my family.
Our work will support the ambition of Leeds to be the best city for health and well-being. We will utilise the fantastic local assets, including our big data resources, our local agencies and our City Council, to enable them to create a healthier environment for our citizens. But it will also support our citizens to make lifestyle choices that enable them to be more knowledgeable, much more capable, have the opportunities and be motivated to lead a healthy lifestyle for their future.